everybody, and welcome. We're so glad you're here with us today. Before we begin, quick housekeeping rule again. If you haven't already, please rename yourself on Zoom with your name and organization. It helps us know who's in the room and makes it much easier to continue conversations after and connections after today's session as well. Thank you so much. For those I'm meeting for the first time, hi, my name is Rod. I'm joining you from Manila. I'm the community choreographer at Pollinate Impact, which means I get the privilege of designing spaces like this one where practitioners, innovators, and ecosystem builders can learn from one another and tackle shared challenges together. Thank you all for making the time to join us for today. All right, a little bit about Pollinate Impact for those who might be new to the network. Next slide, please. We are a member-led network of incubators and accelerators across the Global South. At the heart of what we do is supporting impact enablers, such as yourselves, not just to survive, but to grow stronger, more resilient, and more intentional in how they support entrepreneurs. If you're not part of the community, we'd love to have you. As a member, you get all of these wonderful opportunities and ways to interact with other members. And if that sounds like your kind of space, we think it is, check out our website to learn more and sign up. So the link is in the QR, it's also in the slide, and we'll be sending it in the chat as well. All right. So one thing that we hear often across our network is that many health-focused enterprises are doing incredible work in their communities. Yet when it comes to attracting funding, there can be a disconnect between the impact they're creating and how funders or donors understand, assess, and prioritize that work. Sometimes it's not about that solution isn't effective. It's because the enterprise is speaking one language while donors are listening for another. Sometimes the impact is clear on the ground, but not yet clear in a proposal. Sometimes organizations are solving urgent problems, but struggle to articulate how their work aligns with broader donor priorities, funding strategies, or systems level outcomes. And sometimes there are simply gaps in understanding on both sides. That's why today's conversation feels particularly important. We're exploring a question that many health enterprises are navigating right now. How can we position health enterprises in ways that resonate with donor priorities without losing the sight of the communities and missions we're here to serve? To help us unpack this today, we're delighted to be joined by our partners at Assist Asia, who bring extensive experience working across health systems, development partnerships, and donor engagement throughout the region. We also have with us today some members of the Pollinate Impact Network, Jhpiego and Vilgro Africa, who will also be sharing their experiences with their own health enterprises that they support and how they've navigated this journey as well. Today's session is designed to be interactive. There's a reflection, there's a little bit of role playing that we will be doing, a hands-on activity. So you really have the opportunity to start shaping how you position your own enterprises, whether you are one or you're an incubator, so that it connects more effectively with donor priorities while remaining grounded in the real needs of the communities you serve. So here is our map for today. We are at the welcome right now. We'll be doing a quick check-in activity, and then we'll hear from Byron, who is from Assist Asia, and then our member spotlights, the experience sharing, the chat waterfall, which we'll also do, but there will be an activity there. Quick Q&A, and then we will check out. All right, just to also let everybody know, we have some upcoming events. We do have our potluck appetizer. So cute wordplay for us to kind of really introduce our global potluck that is coming up October 5 to 7 here in Manila. It's a sneak peek of the agenda that we have upcoming. So if you want to learn more about what the Pollinate Potluck has to offer for you, whether you are an incubator, an accelerator, an ecosystem builder, an entrepreneur, this will be a space for you to figure out. And there are exclusive discounts that we are planning to give during that actual session. For members, and maybe for those others who are interested, we have upcoming build table to introduce our upcoming collective action team. So this is now on the topic of strengthening incubator investor relationships for long-term resilience. So it is a way for us to talk about what kind of insights we've already gathered in terms of this topic, and then to see how we move forward to actually do this collectively as a network. And then lastly, on July 22, we have our Growth Check Lab. So we have done this one last May, where we introduced our diagnostic toolkit for incubators, where we cover different aspects of an incubator to see, to assess where they are in terms of their growth, where do they need more improvement. And it's also a way to like self-diagnose and see where the challenges are coming from. So for those who might need this, July 22nd, we have two time slots, one that's more geared towards the Asia time zones, and then one that's more geared to the Africa time zones. We hope you can join us then. All right. Is there Okay, before we move to that, Kavya, thanks so much. I really hope that today we are able to leave with a clear understanding of how donors think, practical ideas for strengthening your position, either as an incubator or as an enterprise, and greater confidence in telling the story of your work in ways that unlock opportunities for support and partnership. So with that, we will get started with our exciting activity. All right, so a little twist on our check-ins today, even for those who have attended some of our sessions. We are doing what I call a makeshift health donor dating game. So I remember one of our partners in the network, Ian, who is the head of Mekong Inclusive Ventures. He likes to think of attracting donors and funders as sort of a dating game itself. So I borrowed the idea. And really for our check-in, I want you to imagine that you're an incubator, you're enterprise, or a donor, and you are trying to help secure donor support for a health enterprise. So we will divide you into breakout groups of three. You will take turns to play two of three roles. You're either the entrepreneur, the donor, or the observer / incubator. And then there will be two rounds, so you will be switching roles. And then really the goal is to discover what makes a health enterprise resonate or not with different donor priorities. Next slide, please. So to clarify what the roles will be, for the first minute, please take time to decide who will start as your entrepreneur. We'll pitch the health enterprise. We will introduce the health enterprise, so no worries at all. You will have a guide in terms of the case study. The donor will listen through a donor lens. You will also give your feedback, and then the incubator / observer will capture insights and patterns. After each round, we'll rotate roles. So the round one will happen now, round two will happen later on, and then everyone should experience at least two roles as part of this dating game. All right, next. This is your health enterprise. Please feel free to take a quick screenshot, and I will also put this on the chat so that everybody has a copy of this when we do our breakout group. All right. And then 3, 2, 1. Next slide, please. Sorry, next slide, please. Great. All right, so in a round one conversation, this will be about 9 minutes. So entrepreneur, elevator pitch, 3-4 minutes to really share about your health enterprise. What are you solving? Who benefits? Why does your work matter? Why should a donor care? And then we'll give 2 minutes to the donor to respond. So I will be guiding this. Please look at the header and on top in terms of the timing. And then the incubator will really capture the insights and patterns that emerge out of the conversation. All right. Is that clear? Do we have any questions? If it's clear, can I please get a thumbs up from the group? Are we ready? Great. Thanks, Joanne. No worries, Nalakshi. All right. Thank you. Okay, awesome. All right, so now we will head on to our breakout groups. Enjoy your time. again, spend the first minute assigning the roles, then already do the pitching, donor, and then the observers will be your incubators. So please, we can do that now. Kavya, if you can please open our breakout groups.
Yes, opening.
Thank you. We'll just wait for the others to come back. Alrighty. Welcome back, everybody. I hope you had a good time trying out the dating game. Right, just wanted to do quick insights. Kavya, if you can bring up the slides, please. Just wanted to know really quickly, any insight that you want to share, you can share it in the chat. You can raise your hand. You can also drop one word in the chat. What did your donor care most about? So for those who were able to do the activity, was there anything there that you feel like they focused on? They wanted to fund because of this? Can you drop it in the chat really quickly? Eye health, not a strategic fit. Thanks, Joanne. Anybody else would like to share? All right, we'll wait for that in the chat. But while we do that, I would like to bring on Byron the to the stage to introduce himself and then to also take us through the main presentation for today for Assist Asia and for us to learn more about health donor priorities in the global landscape. So Byron, once you are ready, you may take over the floor.
Thank you, Rod. Hello, good afternoon. Yes, let me introduce myself first. My name is Byron. I'm the Associate Director at Assist Asia. I lead the team in the Philippines that are reviewing, researching, pursuing grant opportunities, as well as some development consulting opportunities as well. Thank you, Pollinate Impact, for inviting us to share today's discussion. I think so. Assist started more than 23 years ago, and we are mainly a capacity building organization established here in the Philippines. But presently, we have offices in Vietnam, in India, and in Indonesia. We cover a broad range of thematic areas, including food security and agriculture, sustainable economy, health and sanitation, disaster risk, and education, especially around employment and entrepreneurship. Our director, Plato, I think this was slated for some time in May, and he's actually all set to present. But the family matter came up, and so he asked me to present for him. Our unit in Assist is called Research and Acquisitions. And as I mentioned earlier, this unit is particularly tasked to look at donors, grant opportunities, tenders, development sector stakeholders, and write project proposals. Any kind of insight we generate from studying an opportunity or studying a donor, these are all fed back to our business development strategies, and more importantly, in my team, fed back into how we write our proposals. And this is the particular context where I'd like to frame the discussion, my discussion today, because while Assist implements health projects, we are not, just to be clear, we are not a health NGO. or we absolutely don't claim to be health experts. Um, Instead, what we do is to quickly zero in on strategies that strengthen our organization and those and strategies that strengthen our project proposals. So when we were discussing with Pollinate Impact about uh, topics that we could cover for training and discussion, we saw it as a very good opportunity to really take a quick deep dive into a specific sector, and in this case, health, and generate some insights that would be very useful for assist in our proposal development work, and be able to share them as well, how we look at them and how we sort of strategize around what we are seeing, and share it with Pollinate Impact and its members. And so a lot of what you will see are insights and some kind of moves that we are making. Please feel free to validate some of the bold claims we are making. These are, I saw the presentation, the research and the presentation that Plato prepared, and it's really, he makes really bold claims. Um, while these are largely meant for internal consumption, um, but to be honest with you, I think that um, I don't even know if in the past 2 months since we did this research and presentation, if there have been new or like major changes in the health sector already. It's that fall. The changes are coming too quickly, very fast. Wait, let me just load up my presentation.
And maybe while Byron is doing that, if you want to think about any questions that you have or anything that you, any insights, you're free to put it on the chat later so that once we go to Q&A, we can take them up. Thanks, everybody.
Rod, so just share
Yes,
the
please.
presentation. Documents, advanced, screen. Oops, how do I do it? Apologies. For a while. I'm trying to figure out. Share. Sorry, apologies. I should have
No problem.
sorry. Rod, how do I do this? Can I just
I have the slides as well, Byron, if you need me to share, will that be easier?
go ahead?
Yeah, no worries.
There? Okay. Thank you. Thank you, Rod. Yeah, so you'll see this was dated May. um, I think this is what I mentioned earlier about the fast changing environment, development environment is a good segue into the first part of this presentation. Can you move to the next slide? Yeah, so the next slide is so this is the main structure, the presentation. The first is to just present a brief overview of what we're seeing. And then the second part is how we are thinking of reacting or suggestions around what we are seeing. So as I mentioned, but a good segue is that I think the next slide. I think that 2019 was probably the last year when internally at Assist we could claim that we are in a solid footing in terms of how we were planning our programs, especially the health thematic area programs direction. I wonder if any of you feel the same. that 2019 was that last time that okay 2019 was that last time wherein it looks like everything was set. And then of course after 2019 we had the pandemic, and then just recently of course the yeah yeah and then the close. Thank you, Joe. And then of course just last year the USAID closed. So the funding for global health has fundamentally changed. That's how we feel, and that's what we see. Next slide. Just from this 25 to 26, the ODA funding declined. The UN agencies posts were abolished. We saw in some news reports that the WHO headcount will be down by 25% by this month, this year. While the ODA fund right now is higher than it was in 2019, but it's still going down compared to last year. And so what we're seeing is that the overall pool is shrinking, and at the same time, the demand for proof, efficiency, and system alignment has never been higher. Taking from that, we observe three things. Next slide, please. And just to reward it a little bit, it's that contracting multilateral pooled funding, or maybe more state-to-state grants and prosperity-driven or trade-related cooperation opportunities are what we're seeing, at least recently. That's the first one. Second, that as I mentioned, with the UN, the USAID, WHO, there's a lot of institutional disruption happening. And third, what we've seen is that there's really a lot of effort to mobilize the private sector, not just in health, but in many other areas. Just 2 weeks ago, or maybe 3 weeks ago, the ADB, Asian Development Bank, issued a call for expression of interest around blended finance on heat stress for women in the informal sector in the Philippines. So some kind of parametric insurance, trying to bring in, as I mentioned, private sector involvement in this one. So in how we react to it is that we're seeing that largely donors are asking how our solutions could survive in the changing landscape. So that's a key question that we are trying to answer when we do our project design or rewrite our proposals. Next slide. The second block of items that I'd like to cover, of course, are related to the donors themselves. So as proposal writers, we do adjust our tone, our language, depending on what type of donor we are pursuing, whether it be multilateral, bilateral donors, or corporate and family foundations, philanthropies. I think the most simplest, very simplistic way to look at it is that public funds, the taxpayer money, are treated. There's a lot of security needed in terms of ensuring that the money is spent efficiently, effectively. So there's a lot of legal and M&E that needs to go through it. Very, very, as maybe I would say, maybe not so much elbow room for very risk-taking innovation. Whereas, of course, for private money, that's where you can find donors, funders who can take more risks, who are actually really looking for untested solutions. Next slide. But what we, and then just to highlight one major donor, of course, um, I think that the Gates Foundation in the health sector, I think they represent almost 10% of all the development assistance in the health sector. In the ODA, it's US, the top one, Germany, UK, Japan, and France, which together account for about 69% of all ODA. So what happened in the United States had very, very big impact, not just in the health, but in the overall development aid sector. For the Gates Foundation, of course, they recently announced that they're committing $200 billion for the next 20 years. But with that also is the news that they are closing by 2045. And a lot of this funding, they're saying will go to Africa. And then they have this partnership with OpenAI, the Horizon 1000, which aims to equip 1,000 African primary healthcare clinics with AI tools. So we when we review this in our team, we see these as signals into the direction of opportunities or projects we're designing. Next slide. Next slide. Other key frameworks affecting global health funding, of course, is the Global Fund, as well as the General Program of Work, the WHO, the 14th GPW. But I'd like to just point out here is that referencing these health sector strategies are absolutely important, especially when we are pursuing multilateral, bilateral opportunities. Next slide. And then there are, of course, the different categories or different types of opportunities. Those that are system strengthening opportunities and those that are disease specific. While many grants would cover both, our opinion is that the strongest proposals are those that name both the system that we want to strengthen and the specific outcomes that we want to improve. These are a few just things that to be aware of. So that it can properly guide how we design the project proposal or how we write the opportunities, how we write the proposals we're preparing. Next slide. Could you skip this slide, please? Next slide. As well as this one. So yeah, the past few slides that we skipped are mainly around value for money and using the donor language opportunities. But I know that many of you are very, very, very familiar, sensitive to issues around value for money, around minimizing cost and maximizing output, ensuring the effectiveness of the proposals we're making, reaching the most vulnerable, and then how we are sustaining our interventions post-grant. Let me take a few pause here a bit just to ask. I'm curious what kinds of donors you are pursuing. So philanthropy, thank you. For others, if you could just chat a little bit just to see. I'm just curious. Multilateral, okay. Like the EU or the World Bank or Asian Development Bank. Okay. Maybe the African Development Bank as well. Got it. Got it. Thank you. Thank you. Okay. Next slide. And then these are some of how we would react, our moves after looking at this landscape. by like I said, this is please feel free to validate and consume it as that fits your organization. Um, the first one is really about identifying a pathway to scale. So that's the first one. The second one is precisely what we did, the exercise we did earlier about donor matching. Not just in the priorities, the strategic priorities of the donor, but also in terms of the language. As I mentioned earlier, as proposal writers, we change a little bit our tone when we're writing for Family Foundation versus when we are writing for the Asian Development Bank, for example, or a bilateral agency like FCDO or DFAT. And then the last one move that we're making is really around evidence, backing our claims with evidence, especially around equity. And so it means having really thinking through about your organization's M&E or your MIL, your monitoring, evaluation, accountability, learning frameworks and strategies. Next slide. The next few slides describe them in a little bit some more detail, but those are basically the point that I'm trying to make. The presenting pathways towards scales, not just at the prototype or pilot stage. As you can see, it's a direct reaction to the earlier observation that donors are really interested in terms of how the solution could survive after the grant money is no longer available, or in the change, if the aid landscape further change. Next slide. Next slide, please. Rod.
I changed the slide.
Okay, still in the pilot shop. I don't see the next slide.
Oh. Is it changing? Sorry.
There. Go back. So the second one is about donor matching. I think in the dating game earlier, it's about the strategic match. That's the most important. Also about what stage they are funding. You'll probably see a lot of calls that are providing three different levels of funding. Those who are trying to define their solution, those that are trying to prove and generate evidence on their solution, those are trying to scale them either in the private sector or the public sector. So it's largely about matching with the donors in strategic objectives. Next slide. And then the last one talks about equity, and also backing those claims with the numbers. So instead of saying that we are expanding our work across 4 districts, we need to define who the beneficiaries are, who they are, and why it's important to reach them. Yeah. Next. The next slides are more suggestions, a few more moves, and these are again more of a reiteration of what we saw in this review, and some that we are trying to adopt at Assist, and maybe you can also consider. Next slide. This first slide is a reaction to system level solutions, or finding which part of that system is has a problem, or if there's a piece in the puzzle that's missing. and it's important. For example, in our small group earlier about the ambulance, it's maybe it's also good to describe why there what's happening in the system, why there is why there's a lack of that kind of service, for example. Next slide. Again, just a little bit of pointers around how to lead in terms of approaching writing for different types of donors. Next slide. And then again, the equity. So it's no longer we're reaching 10,000 people, but saying that 83% of these beneficiaries are 90 minutes away from the nearest health facility, things like that. Okay. Next. And then this I think is a very important aspect right now in terms of how we are positioning our proposals. And in our opinion, especially in the health sector, is that there needs to be a clear articulation of the government pathway for your solution. Yeah, it's how it can be integrated into the government health system. How could a government be able to absorb the solution? And sometimes it's not still about showing how it will work, but even just to articulate how you imagine it could happen, because maybe you are still at a very early stage. But but right now that needs to be clearly articulated. Next slide. And then finally, as I mentioned, the importance of having the meal M&E accountability learning in your proposals. So in the past, at least, we see that it's like it's some that the end part of the proposals, but now organizationally, not just in proposal writing, I really would like to recommend and emphasize that we really give very, very serious thought around how we are gathering data, our strategy, how we are involving our beneficiaries in our meal framework as well. That's also very important. And we need to articulate that clearly in our proposals. Next slide. Okay, you can skip this slide. Next slide, please. Okay. Slide, next slide. Yeah. So these are just to reiterate three things. The first one is about thinking about how your solution, how your organization fit into the system, and how you are helping improve the system through your organization, through your solution. And then second is that we need to really prove the equity part, not just describe it. We need to have the numbers to back it up. And then third, as I've asked to reiterate for the nth time, to really show the government pathway. Yeah, I think that's mostly it. Rod, the next step, I think the next slide just shows the next part of the program.
Thank
That's
you.
all for me. Thank you.
Thanks so much, Byron. Thanks for taking us through that. There's a lot of really essential
It's very
information that I
dense.
think. No, yeah. It is, but also like there's a lot that I feel like people can really learn from this. And there's a lot of insights, especially at a landscape level, right? Like what we're seeing throughout the global south. So I think that was really important to hear. I'd like to
I'm very
maybe
curious to hear our incubators and our health experts to see if there's like a different angle or a contrary opinion to it, please. Thank you.
Right. No worries. Thanks, Byron. Um, I want to hear if there's anybody who wants to have like a quick question to Byron before I give the floor over to our members. Anybody who has like a burning question that they'd like to ask, maybe clarify from what was shared, you can raise your hand. You can also put it in the comments. It may be 20 seconds. All right. If none for now, you can think about it. Maybe you're still processing. I know there was a lot. I think there's a lot of essential information there. So while you process, I will turn over the floor to some of our members who do cater to health-focused enterprises, and we'd love to hear more about your experience on the ground. So while Assist Asia has showed us kind of landscape through the global south, I think hearing specific context and then hearing maybe some things that have worked for these incubators could really get us into deeper, more maybe nitty-gritty and contextual stories of what worked for some organizations when they were supporting their health enterprises. So I'd like to give the floor over to Joanne to start us off and then to Snider after. Joanne.
Thank you. So first, let me introduce myself, but then I'll give a brief reaction to what Byron shared before jumping into the story. So I'm Joanne Peter. I'm Director of Innovation at Jhpiego. Jhpiego is actually a very large global health nonprofit organization working in around 36 countries. Been working in global health for 50 years, so we definitely are global health experts and mostly implementers ourselves and raising money for our own organization. But since 2022, we've had a program called WISH. It stands for our Worldwide Innovation Support Hub, which is our own accelerator program. So we work there with social enterprises, smaller nonprofits to help them to benefit from what we've learned over the last 50 years. And so I'm speaking from the perspective of WISH. But just to say, Byron, spot on. I thought that was great. I really agreed with almost everything that you had presented there. Increasingly, the pathway to scaling with government seems to be regarded as almost the only game in town. You know, there was a time in which you could scale through big aid. So if you were a small organization, but you could graft yourself onto a big USAID funded project, then you could scale receiving that kind of money, even if it was indirectly as a sub-award or subcontract on a larger implementer's big multi-year bilateral award. But now that those don't exist anymore, it's like there are only two pathways to scale. The one is via the market and the other one is via government. And if you have very much a social impact oriented product or service offering, to scale via the market is very challenging because, depending on your business model, often very low willingness and ability to pay amongst those that you're trying to serve. And so that puts you back in the government camp. And so scaling with governments is everything everybody's talking. They've been talking about it for ages, but they're really talking about it now. And even the philanthropic and corporate donors are talking about it now in ways that they didn't before. So I completely agree with you. And a lot of what you said there around evidence, also very important. I'll just say, the one thing I see so much emphasis on is having a counterfactual. So people will say, we reached this many people, we saw this kind of increase in service uptake or whatever, but they don't compare it to what would have happened if they weren't there. What's happening in the neighboring district where you aren't operating? How do we know these changes wouldn't have happened anyway because of some other things that were changing in the ecosystem? So where is your control group? What's the counterfactual that shows that there's a causal relationship between what you are doing and the outcome that we're seeing? And way too many organizations are trying to have their impact in the form of outputs, the reach, numbers that they've reached, as opposed to outcomes and something with a counterfactual. And donors are getting more and more fussy about that. So let me give you guys just a little story of how we might approach this. We do a lot of work with smaller enterprises that are trying to raise money from donors. like you said, Byron, we generally start with segmenting the donor audience. And most of our enterprises would be looking at philanthropic and private corporate foundations, so private and corporate foundations. And so we would segment that even a bit further than what you suggested there, Byron. So within the private foundations, you'll still often see there's those that are all about cost effectiveness. So the new coefficient giving, give well, the effective altruism crew, they're all about cost effectiveness. And so that's really, really important. Like, how does what you are delivering deliver more benefit than just giving people cash? And so that's the kind of cost effectiveness guys. Then there's the innovation donors, and they are all around your theory of change and your pathway to scale. Then there's often those that are more a kind of grassroots community donors. So they care a lot around equity and around how you're engaging communities and where the community voice is coming through clearly. And then, of course, your corporates, your point about do they want their brand to be associated? Often they focus quite a lot on outputs and on reach, and they want big numbers, and they've put big targets out to the world that they need to deliver, and they want you to help them to contribute to those targets. And if you can have a photograph of a smiling, happy baby or mother or whatever it is, that really often does still speak to corporates. They also want to engage their employees. So if you can offer employee engagement opportunities, corporates often go for that. So we generally would segment the donors even a little bit. We'll do like a funder landscaping and segment the donors more fully. And then we use quite often a framework that's called Fundable and Findable from Mighty Ally. And I'd encourage you to have a look at that, Fundable and Findable. So it says in order to, raise money, you need to be two things. You need to be fundable and you need to be findable. So to be fundable means that your impact is a function of your idea and your implementation. So you first need to, so how good is your idea and how well are you implementing it? How good is that intervention and how well are you implementing it? So you first need to show that those two things are rock solid. So your idea is demonstrated through your theory of change. So what we would generally do first is work with organizations on their theory of change. A very, very robust theory of change, which is not just a simple logic model, inputs, activities, outputs, outcomes, but really looks at the mechanisms by which change happens. Who are the audiences and what behaviors do they need to change? And do those mechanisms make sense? And what evidence do you have for your theory of change? So that's step one to become fundable, is that you have to have a very, very rock solid theory of change backed by evidence with very clear causal links between the different steps of your theory of change. And so we've done that using the Mighty Ally theory of change template with a number of organizations to really strengthen their theory of change. So I would encourage a lot of people to look at that. And then, so that's your idea, making sure that your idea is rock solid. And then the other is your implementation. So that is your strategic plan. So you've now got a great idea, a great intervention. How are you bringing that to life in the world? And that's the strategic plan. And so we typically would work with first your theory of change and then your strategic plan. Do you have a great approach? Well, solid approach on how you're actually going to bring this to life, with strategic priorities and with the team in place, and, it's a strategic plan. And then once you have those two things very, very finely honed, so you are now fundable, then it's about being findable, because most of these, sadly, philanthropic donors don't issue RFPs. There are not many of them that do. Many of them, you need a warm introduction. You need an in. It's all relationships and referrals and recommendations. So they need to find you. And so this is about your positioning strategy and around your kind of marketing and communications. And so, there, some practical tips would be find all of the donors that you are going after and follow them on LinkedIn and engage with their content. See what they're talking about, what they're posting about. engage actively with their content. Become the person that they start to recognize your name because you're actually so often engaging with their content. Even if you don't get to meet them in person, they start to recognize because you're engaging thoughtfully with what they're posting. So, do that. Then, are there any conferences that you're going to go to? Is there particular thought leadership that you can put out into the world? Is there a webinar you could host? Could you invite somebody to form a member of your strategic advisory board, for example? What are ways that you can actually try to position yourself in the network, and where can you get warm introductions? Do you have an existing donor that can open a door for you? So how will you actually leverage your network to get warm introductions? So that's part of your Findable. And then there are some that do issue open calls, often tends to be the innovation donors. So FID, for example, Global Development, sorry, I'm forgetting the name, Global Innovation Fund, sorry. FID, Global Innovation Fund, Div Fund has just done a new one. They do have open calls, and there are quite a lot of innovation prizes, prize competitions that have open calls. And winning a prize gives you outsized visibility. You get the prize plus all of the amplification that comes with it. So there can be, and a fellowship too. If you can win a fellowship like a Malago Fellowship or like a Cartier Women's Fellowship or a Shoka Fellowship, also comes with a lot of visibility. So those are a few things that you can go after to try and position more effectively. And so if you're doing those things, fundable and findable, then you're kind of catering to both sides. So let me stop there. But yeah, we've done that with a number of organizations, and so far helping them to kind of oftentimes diversify their donor base, think differently about how they approach, and get much more clarity in how they're actually positioning themselves, as opposed to trying to be everything to everyone. I'll
Great.
pause there.
Thanks so much, Joanne. Fundable and findable. I like that. Easy to remember. I hope there's a lot there that I think people can get from your recommendation. So thanks so much for sharing. I will pass on the mic to Snider from Vilgro Africa to also share her insights. So Snider, you're ready.
Hello,
Hi.
Hi.
can you hear me?
Yes, loud and clear.
All right, thank you so much. I mean, Joanne and Byron have done such a good job, and I completely agree with what they've shared, and I will not belabor on that, but I'll give examples of how we have worked with one as Vilgro as an ESO, and then also for healthcare enterprises. So when we started our work a couple of years back, most of what we were getting in terms of funding was support in terms of grants and donor support. But we increasingly noticed that even the funder that we had on board really wanted us to have a sustainability pathway where not all the funding was coming from grant and donors. And so what we did was we tried to diversify our funding as an ESO, and that we found was something that most of the funders that were coming on board were really appreciative of, that the fact that they know even if the donor funding is drying up, there's a pathway for us to continue operating as an ESO. That's number one. So they like to see, donors also like to see that there's a sustainability pathway even for venture support organizations like Vilgro. And maybe to delve back, for those who don't know Vilgro Africa, we have been in this space for about 10 years, supporting healthcare enterprises in incubation and acceleration, but also investing in some of them. So we are an incubator, an accelerator, and impact investor in the space. And we've done that for more than 10 years now. Our roots go back to Vilgro, India, but that's a story for another day. But we operate autonomously in Africa. So number one, like I said, donors, we've seen from my experience, they like to see that there's some form of sustainability pathway, even if it's not there now. At least you can show that you're growing. So for Vilgro, we started at 10%. versus 90 for donor funding, but now we are almost 50-50, which is also a good story to tell to these donors. And then number two, and I think Joanne spoke to that, is involving these donors as partners and not so much just as funders. And in that case, it means co-creating with them, designing the programs with them, having them participate as much as possible. Internally, what we do is we have for funders who are willing to do that, we have them participating in steer core committees where they come in and also share their word and also give us feedback, but also employee engagement. We see donors like that. They just don't want to fund you and disappear and come back 1 year with your impact report and hear what you want to do, what you've done, but they also want to see that they have skin in the game. They're participating in what they're doing, and we've seen that work very well. Another example is, and this is for enterprises, there's enterprises that we've supported. Right now, the donors that we are working with as far as supporting enterprises are really, really keen on impact measurement. We've seen a lot of our healthcare startups treat impact measurement as a side and not so much as part of the story that they are building in terms of collecting evidence. And so you find even when you're coming on board, they say, we want funding, but then we're like, okay, so what's the story that will back this funding that you want, right? So you will hear most of them say, topmost priorities, I want funding, I want business modeling support, but then impact measurement is really like at the back burner of what they prioritize in terms of the support that they need. And so part of what we do programmatic wise is really making sure that they understand that it's important for not only for them to collect the evidence, but also to package it in a way that funders can consume it and see them as viable entities that they can partner with. And recently we noticed that in addition to, and most of them, they really say, okay, yes, we do collect. And then you look at the numbers that they share, it's like, oh, I have provided access to, say, 10,000 people to, say, reading classes, for example. But then when you look at the outcomes, they're not very clear. So right now, donors are looking at not just access numbers or that you have screened 1,000 or 100,000 people, but also they're looking at what is the outcome of that. So you screen them, then what? Are there any referral pathways? How many people have actually been able to access this to a point that it has, economically, or rather it has improved their productivity, right? So funders are really looking for that, while on the other hand, startups really look for, or ventures that we support really look for this easy to measure out inputs that really do not directly link to outcomes of what they're doing. Yeah. And then what also has not worked very well in terms of how I've seen ventures show up is chasing every opportunity. And I think Byron spoke to this priorities alignment. We see ventures really, like, you see this funding opportunity, they apply for it without really going back to say, I'm actually wasting my bandwidth applying for 100 opportunities that don't align to what I'm looking for, or that don't align to donors' priorities, rather than really honing in on the ones that are a good fit and learning about the donor more so that they can actually understand what the donor is looking for in terms of strategic priorities and then aligning with that. So we've seen that a lot in the ventures that we support. And so just supporting them through now thinking and sitting back, and what we call internally, we call it decision intelligence, where we try to train them to first prioritize, to understand the priorities of the donor, the problem that they want to solve, and then build a solution based on that, or rather don't focus on those funders that obviously the priorities are not aligned with the ventures and what they're doing. So I think that I will stop there, but I hope it complements what Byron and Joanne have said.
Oh, thank you, Snider. I think those are Really, that's a really great way to kind of close the conversation so far on strategies, right? To really think about it in a more long-term and robust way, also in a more efficient way. I think one of the things that I really got out of what you said was to really get to know also who your donors are and what which ones actually are fit for the ventures that you're supporting also, so that it's not you're applying for 100 proposals, but really like maybe 10 proposals that actually are within the either the interest of the donor, or it's really something that's aligned to their priorities. I think that's really something that's important. Great. Thank you so much, everybody, for sharing. This is a really great session. I think I've learned a lot, and hopefully you all have learned as well. I don't think we have time to do our dating game, so we'll do a quick reflection within our breakout groups also. I've changed up the breakout groups just so you know, so don't feel super surprised if your teammates are not the same as the ones earlier, since we have others who joined in after the check-in. But basically, if you can answer one of the following, so you don't have to answer everything, but you can pick one out of the 4 questions here. Either what's something that's resonated from all that's been shared by either Byron, Joanne, or Snider? What has challenged your thinking? Where do you see the biggest alignment gap? Or what's one thing that you would do differently tomorrow after this session? So let me quickly share this in the chat so that we have this as your guide for sharing. Again, just choose one. We don't necessarily have time for everybody to share everything. We would love to hear it, but unfortunately, we only have 15 minutes left. So if you can share one, that would be awesome. And I will now open the breakout group so that everybody can get to talking and reflecting with each other. Great. Thank you. Hello, everybody. Thank you so
Oh,
much. Welcome back
just
to the
yeah,
main
just
room.
yeah. Thank you, Joanne, for those great insights.
Thanks. I'm glad that you enjoyed your session, your breakout group. Really quickly, maybe just to ask each group to share a little bit about the insights or anything that was shared during your breakout. Um, Anybody who would like to start, any group would like to share any insights, opportunities?
I'll go quickly
Sure.
because I was the one who was asking most of the questions in our breakout
Sure.
group.
No worries.
Just to reiterate 2 things that we discussed. One is about establishing your credibility um, through communication by communicating your work. The depth, the value of what you're communicating. I agree is absolutely important more than the volume of what you have communicated. Then second one is just to reiterate the importance of M&E meal, thinking through the important questions when you're designing a project, a pilot, your theory of change, thinking through the design and the measurement around it. That's it. Thank you.
Great. Thanks, Byron. Thank you so much. How about the other group? Any other insights that you'd like to share? I think the other group were Rohan, Jaime, Mary, and IHJ. Anybody from the group want to quickly share their insights? I just launched the feedback form, by the way, so if you can please fill it up to give us feedback on anything that you'd like us to improve, anything you liked about the session, that would be really awesome. Thank you. Rohan, maybe we can hear from you. Any insights or things that have changed after the session?
Yes, thank you, Rohit and Pollinate Impact, first of all, for giving this wonderful opportunity. I was sort of filling the feedback form quickly. So, like I shared in our breakout session as well, where I was with Jaime and IHJ. For us currently, uh, health knowledge itself is very much fragmented in our country. So I'm from Nepal. So we're trying to work with her. We're trying to design a project where we could work with health entrepreneurs. And for that, what we need to do, what resonated with me was what Joanne said, that fundable and findable, you know, and then aligning your vision with the donors. So that's the biggest takeaway I could take today. And thank you so much. Yeah, thank you.
Great. Thank you so much, Rohan. Yeah, fundable and findable. I think that's also one thing that really stuck in my head. Thanks. Thank you, Joanne. And thank you again, Byron and Snider, also for sharing your insights with us today. Thank you, everybody, for also staying and being with us for this really good session. If you could please fill out the feedback form before you leave, that would be really helpful. And I hope to see you in the next session this coming July. Thank you so much, everybody, and have a great rest of your day. Thank you.
Thank you. Thank you. Thank you. Thank you.
Thank you.
Bye, Ron.